So this is the type of skin that you will see, this foot you will see like this crackles because you might have some leprosy patients near your parishes whom you have to take care. So generally the care that they require is, first they need a treatment for 6 to 9 months. After completing the treatment, they can be almost normal. If they have failed or slowly they are getting treatment, they might get deformities in the hands and the foot, and they need some dressings to be done. So this is the treatment, like this will be the drug regimens both for tuberculosis and for Hansen's disease. There will be lot of pills, they will have to eat 3 or 4 tablets per day and for 6 to 9 months in a long term. Okay? So they should be prepared to do that. So okay, so I have kept in orders of priority because this is very important. Unopened subject, feeling shy, stigma, and many people don't like it to be shared or discovered. So what are all the problems that a boy or a girl can have on their sexual health? So we will take it for a boy first, we will take it for a girl next. So boy, suddenly he sees some erection, he feels, yes? Mycobacterium leprae, a bacteria. It spreads through air. Again a cough. So it spreads through the cough only. So why we don't get leprae is because of our good immunity. So where immunity fails or there is a lack of immunity, so both are called opportunistic infections. Sandarbhavada noigal. Because when our immunity is less, they gain that disease. Once your immunity is improved by means of nutrition and with treatment, the disease goes. Yes? Yes, leprosy is curable, tuberculosis also is curable. Both are curable. That is why I want, my main intention of today's class is break the myths for you to understand. Have some questions?
When they take medicine for continuously for 9 months, 3 to 4 tablets per day, will it not affect the kidney?
Yeah, it will affect the kidney and liver, but the drugs are designed in such a way that they are not overloaded. Definitely it will affect the kidney and liver. So generally the patients who are taking those drugs, they do a kidney function test and they do a liver function test for a long period. For the next 6 to 9 months, they have to do both the tests. Yes, next question. Yes, any other question? Okay, let us give a good round of applause for the class so far, please. Okay, thank you. Why I have asked you for applause for all to wake up, because one or two are sleeping. So sorry for the applause, because this is an important subject, because you might not have opportunity to know it elsewhere, because others you can Google. Here if you Google, all phone pictures will come. If you Google about hypertension, all good pictures will come, but you want to type the word sex itself, you will see Angelina Jolie, you will see a lot of porn pictures, so you will not get the right material for you to understand. So what is about sexual health? So sexual health is predominantly, it is dominated by the endocrine system, which is a tubulous structures. So the moment you see a girl, a boy, what's the problem with the boy? The moment he feels a girl, he feels romantic. He feels attracted. So it is called the rule of law. The Charles Darwin's theory is the survival of the fittest and the perpetuation of species. So it happens on its own. It doesn't require father to come and say, I mean the parental father to say, yeah, parma, the punna para, apada, unakku no, the mother need not say, the friend need not say. So it is a rule of law. It is a rule of nature. So what are all the changes? Why a boy is getting fantasized? He gets very exotic because the moment he first feels the erection, he feels his penis attaining various structures at various levels, he gets fascinated. Because school also the sex education is less, so he should wait to understand that this organ can change its structure and size and shape depending upon the period of time. So by nature a boy sees a beautiful girl or any girl, he feels attracted, he feels his hormone starts secreting. I told you this endocrine system is Wi-Fi. Wireless structures. யாரும் போய் சுவிட்ச் எல்லாம் போட தேவையில்லை. அந்த ஊறுகாவை நம்ம பார்த்த உடனே நாக்கில் எச்சில் ஊறுது இல்லையா? The moment you see a pickle, the tongue salivates. So similarly, when a boy sees a girl, his hormones from the testes and from the pituitary starts secreting. So slowly he will go and stand beside her. He will start conversing with her. So he will slowly get the phone number. Then go into chatting. This is how it exactly happens. So what are all the changes that he can happen is he can have some secondary sexual characteristics like axillary hair, pubic hair. Lot of his co-students will say, inga idu varakudada, anga idu varakudada, unakku ipdi irukkuda, unakku appadi irukkuda appdinu. So what are all the various abnormalities which is normal? So the first is the size of the penis. Second is the size of the scrotum. Scrotum generally is a bilateral structure. A symmetry is lost slowly. The left scrotum is slightly lower than the right scrotum. The left scrotum is slightly lower than the right scrotum by development for all males. Yes. Secondly, the scrotum itself can change its structure depending upon the temperature. In hot climates, the scrotum will hang, the skin will be thin, the testes will go away from the body. Whereas in winter period, cold temperature, AC, the scrotum skin will become thick like a crocodile's skin. You will see lot of rugae on it, just sticking to it. Enna verakutta ivlo chinnada aidichu appadinu feel பண்ணுவாங்க. Then it will go close to the body. So what you have to understand is, for the germiogenesis, for the testes to function actively, it needs a very good temperature, a normal temperature. If it is very hot, it goes away to make itself cool. It is very cool outside, it comes sticks to the body to make itself little warm. So this is very important. That is why putting a tight jeans pant, low waist, zip just putting across it, it harbors the function of the scrotum. You see lot of infertility after wearing tight pants. I am not saying jeans pant alone. You can wear jeans, the cloth doesn't matter, the fitting matters. The scrotum, there should be, சொல்றாங்க இல்லையா, fridge வந்து don't keep it against the wall, keep at least 1 foot gap for it to air conditioner. மேல கேப் இருக்கணும், கீழே கேப். மேனுவல்ல படிக்கிறோம், இதுக்கு மேனுவல் இல்லை. So nobody knows. So science, it requires temperature regulation. A scrotum cannot be hanged by putting tight jeans pant or tight pant. This is very important. So a boy is fascinated, and then among the peer group he says, எனக்கு இவ்ளோ பெருசு இருக்கு, உனக்கு இவ்ளோ பெருசு இருக்கு. They feel that a bigger penis is more masculine. The child thinks, a boy thinks, அவங்க ஒரு 8th standard 9th standard வந்த உடனே இதெல்லாம் பேச ஆரம்பிப்பாங்க. உனக்கு இப்படி இருக்கா, கிளாஸ்லயே அப்படியே என்ன பண்ணுவாங்க, பேண்ட் ஜிப்பா ஊத்து காட்டுவாங்க. This happens. This is not because it is a stigmatic topic. So you have to understand what happens. They used to see, but once they get the erection, எனக்கு உனக்கு இப்படி இருக்கு, at that time that boy would have not got erection. So you will have ஒரு ஈயோ உனக்கு. They used to bully some children in the school. ஐயா அவன் போட, அவன் ஒன்றும் இல்லை அப்படின்னு சொல்லுவாங்க. So the size of the penis doesn't matter. The penis can be averagely from 4 inches to it can be up to 9 to 10 inches long. all can give birth to species. So the size of the penis doesn't matter, the size of the scrotum doesn't matter. Sometimes in a scrotum one testis may be absent because the left testis descends earlier, the right testis descends later. It's called descent of the testis by development. So a child can be born either with no testis, he is not a transgender. Please understand, a child being born without testis is not a transgender. During the descent of the testis may be in the groin. வரப்பட்ட இல்லையா, ஐயோ இவன் லேடிஸ்ப்பா, இவன் லேடிஸ், இவங்களாம் இது இல்லை பார்த்துட்டு எனக்கு வெறையே இல்லையே அப்படின்னு you should not. He should go and meet a physician, a doctor. The testis may be somewhere in the groin. The doctor will do a small operation and pull the testis down and tie it around. Then he can have a normal life. Even with the testis at the groin, still he can function. But it is not good to a testis being in the groin. Only if you keep in the skin of the scrotum, then only the temperature regulation will happen. Else the testis will be always warm. It will not function. So the testis may be absent, which is curable. The testis may be one absent, still it is curable. Even with one testis removed, he can still give birth to a species. This is regarding a boy. Next, regarding to a girl, again the size matters. Periods இருக்கு, மாசம் தலைக்குத்தி இருக்கிறவங்க நார்மலாக. Sometimes the periods can range for 50 to 70 days. 2 மாசத்துக்கு ஒரு தடவை தான் தலைக்குத்தி இருக்கிறவங்களும் இருப்பாங்க. The menstrual cycle can be only for 70 days, 80 days. Still it is normal. They can give birth to species. They can have a change in the structure of the breast. So breast, she is having this size of breast, she is having this size of breast, she cannot give feeding. So they think இவெல்லாம் குழந்தை பெற்றுக்க முடியாது, இவருக்கு மார்பே இல்லை. The rule of law is, however thin is the breast, still the mother can feed. Please engrave it in your minds, even this much big breast or this much thin breast, still the mother can feed the child. The intention of the mother to feed the child is more important than the size of the breast. The mother should be anxious, lovable to feed a child. So that is important. If they are engraved with some failure of thoughts with that, when nobody is opening the topic, the only the peer group, இவன்ட்ட சொல்லுவான், அவன்ட்ட சொல்லுவான், மாற்றி சொல்லுவான், nobody knows the rule. So if you know these important points, I have given you only the golden points. I am not going into the stories, how a breast develops, how a testis develop. I am hitting on the points which is true, which is not true. Okay, so here we end. So what are all the abnormal behaviors that a boy, now I said you what are all the normal behaviors of a boy and a girl. Now we will go to the abnormal behaviors of a boy and a girl. So generally the first abnormal behavior which is still normal is the first problem with the boy is the masturbation. Masturbation, they think that it is a sexual problem. It can be so if the boy is perverted in the sense they will அந்த கோயட் ஸ்கூலாக இருந்ததுன்னா அந்த பொண்ணோட சாக்ஸ் எல்லாம் எடுத்துன்னு போய் வச்சுப்பான், அந்த பொண்ணோட கிளிப்பு, அந்த பொண்ணோட ஷூவு, அந்த பொண்ணோட இயர்ரிங்ஸ், இயர் பேண்டு அதெல்லாம் எடுத்து he will have some sexual gratification. He will have the tendency to peep and see. Ladies bathroom, school, girls bathroom கிட்ட போய் நின்று பீப் பண்ணி பார்ப்பாங்க. This is not normal. நான் இவ்வளோ நேரம் சொன்னேன், எரெக்ஷன் பற்றி பேசுறது, சைஸ் பற்றி பேசுறது, ஸ்க்ராட்டம் பற்றி டாக்கிங் இஸ் ஆல் நார்மல். ஸோ ஹியர் யூ கேன் need not punish the boy, need not want the boy, just come and sit with him and talk with him and tell him these points. These are all normal. Everybody has this. Sam has that, Nadesan has that, Ibrahim has that, everybody has that, you can say. But now what I am saying is not normal. Masturbating very excessively, mild masturbation, minimal masturbation is normal. It will be present in every male. That cannot be considered as a disease. But excessive masturbation, ஒரு கிளாஸ்க்கு இடையில போய் பாத்ரூமில் போய் மாஸ்டர்பேஷன் பண்ணிட்டு வர்றது, இடையில வந்து பீப்பிங் இன் டு கேர்ள்ஸ் பாத்ரூம், keeping their things, keeping his external genitalia always open to be seen whenever a girl passes by, it is called exhibitionism. pipism. So this is called by various diseases, but this is not normal. The boy should be picked up from the class. He should be sent to a psychiatrist or first to a doctor. For him, he needs some treatment. Similar problem may be seen in a female also. So I am not going into the depth of that. And regarding the last point, cleaning the private parts. Cleaning the private parts very important. So generally, except Islamism, others always have the foreskin. For example, in a male, they have a foreskin. Foreskin is called a muntul. So the foreskin is generally retractable. It is retractable. There is some, if you don't, several people in my OPD they come and say, sir, adala the toll alla namala edippa maattom sir, enga ayyo adala thappu sir, adala naanga pandradilla appadina eppiyadu udalal irukumbodhu adu pona undu appadi kedadu. Daily during bath, the foreskin has to be retracted back. There will be some white soapy powder. நம்ம பவுடர் தண்ணியில் போட்டால் எப்படி இருக்கும் அது மாதிரி பிசு பிசுன்னு இருக்கும், which will be foul smelling if you don't wash it daily. So that has to be pulled back, wash it, then again pull back again. Only to prevent this problem only, Islamism they follow theory called circumcision or sunat operation. So in sunat the powder doesn't settle, the penis is clean. So the penis cleaning is very very important. It has to be done daily during bath. One point. Second point, in females, washing the private genitalia, the genitalia has to be washed from front to back. Because by washing back to front, the fecal matter can come and sit into the vagina and the girls can have urinary tract infection. So the girls, school girls should be educated to wash their genitalia from front to back, not back to front. This is very important. And regarding girls, that is another important point what you have to understand is about the white discharge. White discharge is normal just before menstrual cycle or just after menstrual cycle or just before giving birth. So white discharge is normal only in 3 entities. Just before menstrual cycle, thalai kuthikathu minna, bleeding ஆரம்பிக்கிறதுக்கு முன்ன இல்ல bleeding முடிஞ்ச பின்ன அல்லது just before delivery, குழந்தை பிறக்க போகுது அந்த நேரத்துல கொஞ்சம் white discharge வரும். Other than this 3 times, getting white discharge is not normal. White discharge otherwise is called curdy white discharge. பால் திரிஞ்சா போலயும் தயிர் போலயும் இருக்கும். Generally it is a fungal growth. It is a fungal growth that happens in the female. Diabetes being very very common, diabetes is a predisposing factor for white discharge in females. Diabetes is a predisposing factor. When a person has diabetes, the female can have white discharge. Similarly, when a male has diabetes, he will have some difficulty in retracting the skin back. A diabetic male will have a difficulty in retracting the skin back. So he will have some white discharge on the penis, and he, when he is having intercourse with his wife, he will spread the disease. So that is why when you treat white discharge, you have to treat both the male and the female simultaneously. Then only the bacteria and the fungus will be eliminated completely. Okay. Okay, certain small points that you have to know about the POSCO law. POSCO's law, POSCO, POSCO's law, Prevention of Sexual Harassment law. So, what are some important points? When you call the person minor and major is 18 years, very very important. Deciding a sexual intercourse for a female is decidable by the female. Even a husband cannot forcibly intercourse his wife. Still the husband can be penalized. Just by tying the Mangal Sutra or putting a ring doesn't give him the liberty to, if the wife is not convinced with a sexual relationship with the husband, that is she is not liking because he is having some other problem, he is not, she can forcibly stop. அம்மா நீ இவனுக்கு தானே கட்டியிருக்க, அவர் கூட படிக்க சொன்னா நீ ஏமா இல்லற வாழ்க்கையோட பிரச்சனைகளோட வந்து they can come to your marriage with a family dispute. They'll come and see, எங்கள் வீட்டுக்காரர் எப்போ பார்த்தாலும் முடிச்சுட்டு இருக்காரு, அவரோட எனக்கு வாழ விருப்பம் இல்லை, எங்கள் வீட்டுக்காரருக்கு he is having some extramarital relationship, that is why I am not able to live with anymore. So a female can still, if he is married, if he is not willing to have a sexual intercourse, then the intercourse is called a rape, even if marriage is done. This is very very important legal point that you have to note. And otherwise, without marriage, a sexual relationship without marriage, marital status is illegal still. And below 18 years, any sexual relationship is called child abuse. So child sexual abuse, these are all the important points that you need to understand. Okay. So we'll give a good round of applause. One topic is over. Because why I am taking some steps to make you all awake, because else you will read elsewhere. This you should get some opportunity, and it is not I am overemphasizing my points, because I am trying to give the best within this today. So I am touching on all the points which is very very useful to you. So I want everybody to be awake. So that's why I am giving you some applauses here and there. So next topic what we are going to is malnourishment. Malnourishment is generally a myth that is understood. Some understand, பாவம் இந்த பிள்ளை ஒன்றும் சாப்பிட வழியே இல்லை, ஒதுங்கி போன வயிறு, ஒதுங்கி போன கண்ணம், malnourishment அப்படின்னு சொல்கிறோம் இல்லையா? அப்படி சாப்பாடு வழியில் அங்கே not able to buy food, not able to procure food. Similarly, overeating like me, there is a belly, a lot of arms, there is a belly in the face itself, is also called malnourishment. BMI less than 18 or BMI more than 23 is called malnourishment. So being thin, BMI, how do you calculate BMI? BMI above 18 years. So below 18 years you cannot compare BMI. BMI should be calculated only for above 18 years. Less than 18 years there is a chart to be used. So we will not go in the depth of the chart. It is very difficult to plot. Generally you will be seeing above 18 years. Children also you will see, but children we have some clinical pictures from where you can identify. But for adult, the BMI should be between 18 to 23. BMI is measured in kg per meter square. So body weight in kg divided by height in meters. For example, he is 153 centimeters, so 153 square. So divide your body weight in kg, numerator, denominator. So above 18 to 20, below 18 or above 23, it is called malnourishment. So what is the commonest malnourishment that you see in children is protein energy malnourishment. What is protein energy malnourishment? In female families, they are not able to eat, even one meal a day. Very tough family, very very tough. How the child will appear. So again we are having a break. Okay, 5-minute break. Okay, let 1 o'clock only you have lunch? No. 12:30 to 2:30. Today we will have a small lunch break, because previously they used to have 2 days. Okay, so it is not I am trying to tax you, but I have come with a good subject for you to remember. I will not put blade or hooker, so I will put only important. So I am making it more pictorial. I am giving my thoughts. So we will have a small lunch break. Come back again. Okay, thank you. At 12:30 only. Are we breaking for break now? Lunch break. Okay, we will break for lunch.